discuss with you today posterior heel spur. You know, we do it one of two ways. One way is a traditional way where we make an incision on the tendon and pull the Achilles off the bone and remove the spurring and put the tendon back down with bone anchors. Normally we move the tendon forward, which gives us sort of a Murphy's type procedure, so the patients get lengthening. In this case we got that, so if you look at her, pull your foot up, see how much more she got a lot of lengthening. Before the surgery, she definitely had equinus in her foot, especially gash-like equinus. So this took care of this by moving her equinus by moving the tendon forward. That's something you can't do in minimally invasive surgery, but you can do that in open. This is a technique I use when people have a huge heel spur. We make an incision medial and then down lateral and this way, and that gives us a muscle flap here with the tendon and allows, it prevents the hisness you can get with these really large spurs. She had an extremely big spur, not amenable to minimally invasive surgery, and a tendon that was rather tethered from this spurring. Now, we want to kind of look at the difference between this and minimally invasive surgery. Hers was an open surgery. We did this 9 months ago, that's right. She said before the surgery, you were from 1 to 10, your pain was what again?
10.
10. So before the surgery was a 10, and now she's down to a 2 VAS score. So it's still not 0, but she's a lot better. In her daily activity, she can do about what she wants to. She's got her shoe there. Hadn't tested it at work yet, but we want to kind of contrast this, and we're doing some research on this behind the scenes too. These patients, the VAS scores are obviously a lot higher until about 6 months or so. And some patients get better in 3, but it's around 3 to 6 months, and sometimes up to a year for this to get better. Whereas in a minimally invasive group, patients are pretty good at anywhere from 4 to 6 weeks. They can kind of get back to normal activity.